The last of the hundreds of traveling nurses that helped Hawaii during the worst of the pandemic left the state today. KITV4's Christian Concilio explains why that's cause for alarm for many in the healthcare field. Christian.
Yes, Rick, Mika, the situation's exacerbating an already struggling workforce trying to recruit and retain more nurses. Nurses funded by the Federal Emergency Management Agency to help Hawaii during the latest COVID surge worked their last shifts this week. And now hospitals are scrambling to contract more workers as a union representing nurses sounds the alarm about dangerous staffing shortages.
You know you're not giving the care you want to. You know that you're not giving your patients the care they deserve, that they should have, that bad consequences can happen.
The pandemic exacerbated a healthcare worker shortage with many nurses leaving the profession. And coupled with the rising cost of living in the islands, many others are choosing not to stay here.
The price of housing, the price of gas, the price of utilities, all of that means that Hawaii is not competitive for nurses. Now, this cost of living issue that we're dealing with here in Hawaii is impacting many segments of our society.
That's according to the Healthcare Association of Hawaii. Hawaii has the second highest average salary for registered nurses in the nation at about $106,000. But the Healthcare Association says when you factor in cost of living, the state drops to the lowest.
The healthcare system cannot survive without nurses.
The state received $90 million for nurses and other healthcare personnel during the Delta surge and another $95 million from the federal government during Omicron. Now, all of that has now gone away, so some hospitals are trying to contract more nurses on their own to help the workforce shortages, but that comes at a steep cost. Reporting live, Christian Concilio, KITV4 Island News.